Carroll County has a history of successful collaboration, people working together to improve the quality of life of the entire community. An issue that requires a great deal of community effort is homelessness. Every night in Carroll County, there are 100 or more men, women, and children who are homeless. There are 93 beds in our shelter system, and there are waiting lists for beds most of the time. In the winter, more than 100 people are housed each night, with many coming into cold weather shelter to keep them from freezing to death. The purposes of this presentation are to give you some information about homelessness in Carroll County, to inform you about the current collaborative plan to prevent and end homelessness in our county, and to engage you in this effort. Our plan is part of a national initiative that affects every local community. The Carroll County Circle of Caring Homelessness Board is a voluntary collective of 96 individuals representing nearly 60 public, private, and nonprofit agencies and organizations. It collaborates to assist our citizens to meet their fundamental needs, including access to basic housing, food, and health resources that they may live with respect and dignity. This picture you see is a barn raising, and the barn raising is the classic community response to build something that could not be completed alone. Genuine collaboration is critical for communities. In these rapid times of change, economic uncertainty, communities are being called upon to adapt to changing environments as they attend to the needs of their citizens. They must develop more collaborative ways of working to fuel innovation and to better serve their communities. What is homelessness? In 2009, Congress passed the Homeless Emergency Assistance and Rapid Transition to Housing Act, which sought to align definitions for homelessness. The HEARTH Act defined the homeless as an individual or family who lacks a fixed, regular, and adequate nighttime residence, including not only the sheltered and unsheltered homeless, but also those who will imminently lose their housing, have no subsequent residence identified, and lack the resources or support network to obtain permanent housing. In addition, a person can be homeless when fleeing domestic violence, sexual assault, or stalking. The most common image of homelessness is the single adult male or female. In this slide, you see Ted, who was chronically homeless. Chronically homeless individuals are defined as disabled adults who are homeless for more than 1 year or homeless 4 or more times in 3 years. In January 2012, when the Circle of Caring completed its count of the Carroll County homeless, 19 chronically homeless were identified. Not all of them were in shelter. The actual number is higher since there are many difficulties in locating the homeless. Those of us who help with the community meals in Westminster know a tall, chronically homeless man who is very helpful, but he lived on the streets for over a year before he decided to ask for help. In October, he entered in the men's shelter that's run by Human Services Programs of Carroll County. Another group of homeless are students in schools. This group includes children awaiting foster care, children living with families in shelters, doubled-up families, families living in hotels or motels, and unaccompanied youth, those not in the care or custody of parents or guardian, including teenagers who are sleeping on friends' sofas. Homeless families is a group growing in Carroll County and around the country. Human Services Programs of Carroll County operates the Homeless Women and Children's Shelter and the Intact Homeless Family Shelter. These shelters hold 46 beds. Both are full, and there is a continual waiting list. The daily routine in a women and children's shelter is similar to a typical day in anyone's home. Women help with daily chores and preparing meals, and women and children enjoy meals and snacks together. They also participate in crafts that volunteers bring, such as decorating pumpkins. The number of unaccompanied youth and young adults is also increasing. This group is under 25 years of age and includes runaways, those leaving foster care, and youth who are forced out by families. It also includes children who are separated from their parents due to a lack of housing. One statistic that demonstrates an increase in Carroll County are those using the cold weather shelter. 27 young adults aged 18 to 23 used the cold weather shelter in 2011 and 2012. This number has doubled in the past 2 years. It is not uncommon for young adults to work at a temporary job during the day and stay overnight at the cold weather shelter during the night because they don't make enough money to rent an apartment. Carroll County also has homeless veterans. All 8 of the veterans who were identified during the formal count in January were sheltered. According to the Veterans Administration, Carroll County is estimated to have over 100 homeless veterans who are most likely living with family or friends. The homeless served in fiscal year 12 in shelters run by Carroll County has been 505 people. On this slide, you can see the breakout of men, women, and children served through the Homeless Women and Children's Shelter, the Intact Family Shelter, the Homeless Men's Shelter, the Domestic Violence Safe House, Safe Haven, and the Cold Weather Shelter. Safe Haven is a shelter for the homeless with severe mental illness and other debilitating behavioral conditions. Daily life includes the normalcy of meals, chores, and conversation. These photographs were taken on a November day at the Carroll County Safe Haven Shelter. In anticipation of Christmas, you see Gary decorating a tree for his room. Kelly, who's currently reading a book of stories about women in history. Then there's David, whose job is carrying the food trays from the hospital. This is Lee, who was sick on the day of photographs, and he was being driven to the doctor's office. There are 5 objectives in the Carroll County 10-year plan to end homelessness. Here you see Objective 1, promotion of collaborative leadership. Objective 2, increase access to stable, affordable housing. Objective 3, increase economic security and self-sufficiency. Objective 4, improve health and stability. Objective 5, retool the homeless crisis response system. Objective 1, promoting collaborative leadership. The Carroll County Department of Citizen Services, with the collaboration of 29 agencies and organizations, has created and will be managing a shared data system called Community Service Point. This allows organizations to improve services to clients and maximize limited resources. Community Service Point currently has client data on 29,064 unique individuals. During the fall of 2012, several agencies that serve homeless youth and young adults met to discuss the rising numbers and do some problem solving. All discussions that took place have been included in data reports from the Community Service Point database. This is one example of our collaborative leadership. The Carroll County Department of Social Services sponsored the 2nd Annual Homeless Resource Day in October 2012 at Winters Mill High School in Westminster. The event provided an opportunity to bring together resources to assist our homeless population with an ultimate goal of achieving self-sufficiency. Last year's event was managed by 160 volunteers and 75 service providers. Private donors and local business contributed mightily to the cause. Together, we were able to assist over 200 homeless individuals, including 60 children. Objective 2, increase access to stable, affordable housing. Research shows that people are more likely to develop self-sufficiency if they are in housing. The Circle of Caring Prevention Committee has developed a flyer for those who are facing imminent eviction. These public and private agencies can maximize their resources for the common good. Groups contribute to the total cost of preventing an eviction by combining resources. All of these agencies are members of the Circle of Caring. Last year, 216 evictions were prevented. In addition, through HSP and other agencies, over 5,000 citizens are supported through other emergency and energy assistance programming. The Circle of Caring Housing Committee has met with town managers regarding affordable housing, and they created a report in October of 2012. The creation of that report was helped by the 8 municipalities who participated. Possible housing opportunities were identified, such as the Brethren Conference Center in New Windsor. Networking will allow for advocacy and development or renovation of other areas. This committee is currently following the registration and inspection ordinance through the City of Westminster. Objective 3, increase economic security and self-sufficiency. Several workforce development programs are collaborating to find ways to attend to the needs of the homeless and imminently homeless. The Business and Employment Resource Center, or BERC, the Department of Social Services, Human Services Programs, and the Division of Rehabilitation Services cooperate to define responsibilities and ensure all citizens have appropriate services. The homeless and at risk are not always ready to enter the job market immediately, and they benefit from targeted services and volunteer work. In response to concerns of an increased presence of people gathering on Main Street in Westminster, the listed parties met several times over the course of the last 2 years to address this issue. The results have been a quieter Main Street and a community garden at Dutterer Park given to human services programs by the City of Westminster. It has been used as a workforce development and self-sufficiency project. Objective 4, improve health and stability. Collaboration includes sharing a common space so that individuals with overlapping issues can be served in a one-stop shop approach. In this instance, Access Carroll, which address physical health, is moving to 10 Distillery Drive. The Bureau of Prevention, Wellness, and Recovery, which addresses addiction and mental health, is offering services at the same site. Collaboration also works between professionals from different disciplines when serving the homeless and those at risk with mental illness. The Youth Services Bureau has a new interdisciplinary team in place that serves clients with severe and persistent mental illness who have not responded to traditional mental health services. Some of these clients are homeless. Objective 5. Retool the homeless crisis response system. Carroll County has a well-functioning shelter system that continues to seek ways to improve. Human Services Programs oversees 6 shelters in our community. Carroll County now has a coordinated intake procedure for shelter and housing assistance. HSP's intake coordinator for shelter and housing meets one-on-one with individuals in need of shelter, housing services to discuss their individual situation. The applicants are referred to not only departments within HSP, but also other community agencies that may be able to meet their needs. The goal of the screening and assessment process are threefold: prevention of shelter utilization when possible, diverting people when their situation or needs require programs better suited to meet their needs, and timely admittance to shelter and housing programs for eligible people as soon as possible. They are provided a resource packet that includes applications for Westminster City and Carroll County HUD, a list of local subsidized units, local sober homes, and information on soup kitchens and food pantries. The goal is to prevent homelessness whenever possible. For those who become homeless, the goal is to move them into permanent housing as soon as possible. Currently, 450 volunteers help HSP with programs for the homeless and at risk. The recent adoption of the HEARTH definition of homelessness now includes student homelessness as defined by the U.S. Department of Education. Several services are already in place: the Carroll County Public School System, the Homeless Birth to 5 Committee, and the Shelter System of Human Services programs work together to serve these students. The school system provides bus transportation to the home school for all homeless students, including those housed in the shelters. In addition, after-school tutors are provided at the shelters, and resources are there to enable homeless students to have free lunch and breakfast, school supplies, and to participate in all school activities that are provided through school resources. There are many collaborative efforts that are not part of the 10-year plan but affect the homeless and at-risk greatly. One example is the community meals or soup kitchens around the county and the daily meals in Westminster, all run by churches. Another example is the newly completed transportation plan that intends to increase transportation accessibility for people to get to doctor's appointments and their workplace. Join us in this effort to prevent and end homelessness in Carroll County.